My name is Dr. Catherine De Ugarte. I'm a specialist in reproductive endocrinology and infertility. I would say that the medical part of the procedure is the simplest part of the process. I think the decision of giving your embryos to somebody else and the decision of accepting embryos from somebody else is 1,000 times more difficult than the actual medical process of getting an embryo transferred. Patients who donate their embryos usually donate their embryos many years later after creating their embryos. Medical requirements for couples who are donating their embryos may include a blood test, a physical exam, and a questionnaire. FDA testing is highly recommended for patients who give their embryos to another couple. Ideally, you want the embryo to be a good quality embryo. So we look at the grade of the embryo. Sometimes they are genetically tested, sometimes they're not. And then we also see how the embryos are frozen, and we want to make sure the quality is good so that the couple who is getting the embryos has a higher chance of getting pregnant. The medical information in terms of the embryos that are being received by a couple can vary from clinic to clinic. In some clinics, there's no information except for ethnicity and quality of the embryo, and that's all the couple who's receiving the embryo gets. In some clinics, which are a little more thorough, they get more specific details. The recipient must undergo several tests to make sure she's healthy to carry a pregnancy. For me, it's very important that we have a healthy mom and a healthy baby. We also require that their uterus is evaluated. We recommend doing something called a sonohystogram to evaluate the uterus, as well as hormonal evaluations to make sure their hormones, such as thyroid, are all perfectly in balance before they receive these embryos. If somebody's over 45, we do require that they undergo cardiac screening, such as a EKG stress test, as well as a letter of good health. The process of embryo transfer in an embryo donation setting is actually quite simple. The recipient has to undergo through estrogen pills, usually, for about 3 weeks, and then either progesterone shots or progesterone vaginal inserts up to a period of 10 weeks of pregnancy. So the day of the embryo transfer is exciting and also nerve-wracking for some patients. The transfer itself is very similar to a process of getting a pap smear. There's a speculum that's being inserted into the vagina, and then we usually do an ultrasound to show the patient where the embryo is being placed. And then when we put the embryo in, we put it with a catheter through the vagina directly to the cervix and into the uterus. And once the transfer happens, 10 days later, they find out if they're pregnant. I always recommend psychological evaluation for the couple that's receiving the embryos, as well as the couple that is donating the embryos. I think it's very important that they have the same ideas about what they will tell their children. Most clinics, such as mine, require also a legal consent so that it's stated in paper who's getting what embryo from which couple. My advice for anyone who is pursuing embryo donation is that they are consistent with each other. So I think that's important that everybody's on the same page.